Hi, so these are instructions for conducting a literature survey. We're going to begin by me sharing my screen, and I'm going to describe exactly what needs to happen step by step as you're doing a literature survey. So the first thing you will receive is a Excel worksheet or a data mining worksheet. And in that worksheet, there will be four different worksheets. So this is a workbook. And in this workbook, there will be four different worksheets. In the first worksheet are instructions, which read perform a PubMed search. And then there are search terms that you can use to perform, that you will use to perform the search. And then the search paper results should not be reviews, and I'll demonstrate that. And then once you have all your papers, you will send them to me, and I will participate in the review with you, and then we can determine which papers you can mine data from. Once you have those papers identified, you will pick certain, we call it a DOI, and I'll show you where it is. That is on the papers that you select, and you will copy and paste it into a second website, which is Sci-Hub. It's a free website. Somebody has uploaded all papers in there freely, and we can use that to mine papers. The number of papers you have will depend on the target area disease that you're researching. Then you will extract the data from all those papers and input them into the CBD worksheet. And what you will use is the example, which is the previous worksheet before the CBD one. Last but not least, you have one last worksheet, which will have your hours, the hours that you will do every day, the mining that you will do, and that you will put in the hours, and then the hours will be paid at a rate of 200 shillings, and the total amount will be on this side. And then you will ship this, you will copy and paste this, or you will PDF this and send it to me at info.candy.com. Those are the steps you will be following. So how will you perform the PubMed search? PubMed is a public database populated by the US government under the National Library of Medicine. If you search for the term PubMed online, it takes you to, you can use Bing or Google or whatever search engine you're using. It takes you to PubMed, which is the official site of the National Institute of Health, which is a government website, a US government website. You can read more about it in Wikipedia or under the PubMed link, and you can learn more about what goes on in there. So when you click on that link, it will take you to this nice blue page: National Library of Medicine, National Center for Biotechnology Information. So all published medical literature resides in this repository. You can search by name, you can search by paper, you can search by DOI, and I will show you shortly what you will be looking for. So in this website, as you can see, you can learn here, you can find articles, both clinical and preclinical, so animal research and human research. And you can do a lot more else in there, but for today, we are just going to focus on identifying published medical literature. So once you're on this page, you will identify, you have already search terms that we will have agreed on, and I will put them on the worksheet that I sent to you. So most of the work will be based on cannabidiol. Cannabidiol, for the most part, marijuana, for another search term that will be commonly used, and then cannabinoids. And what we're trying to do here is just identify whether others have done the work that we want to do for this particular compound. So cannabidiol is a chemical structure that is extracted from the plant cannabis or the plant marijuana, whichever term you want to use. And so once you have once you have your search terms, you will input them here. So for this particular search, we are going to look at cannabidiol and say anxiety. And then we hit the search term. And when you look at the first thing, when you arrive on this page, you will find the total number of results that your search has picked up. And on this end, you will also see when these papers started getting published. So they date back to 1982 all the way to the year 2022. There are 3 pages with information here. You can save this information. You can email it to yourself or to somebody else, or you can send it to another place, I'd say a clipboard, and copy paste it somewhere else. You can sort these search terms by first author or by year, by several. There are many ways of sorting the data through, but for now we're just going to keep them based on the most recent paper published on this topic. When you scroll down a little bit further, there are other ways of analyzing the data. So you can look for abstracts, you can look for free full texts, papers with abstracts, papers with free full texts. You can pick papers that are fully they have text, but even if it's not available, but these free full texts, you'll find the papers on this website. You can find associated data if it's not present. You can also find book articles, clinical trials, all kinds of data. You can limit your searches by years. So these are filters on the left, and you can feel free to use them if you want to use them or not. For my part, I want to focus on papers that have got scientific data, so work that people have done to show whether or not cannabidiol can be used to treat anxiety. And so let's start. What are we looking for? So the first thing is, like I stated on the list of instructions, is that you do not want any review papers. So you're going to be looking at papers that have data. And so this guy, if it has review, it should say review on the side. So this particular guy talks about cannabidiol taken during public speaking. So that tells me there's some anxiety there. There might be some data. The review is what we don't want, unless you would like to read it and see what they're talking about. This is another paper that is probably good for anxiety. This is a review, we don't want it. Action of cannabidiol on anxiety. Okay. Beyond the CB1 receptor, is cannabidiol the answer for disorders of motivation? That's a review, we don't want that. Cannabidiol reduces anxiety in mice. Yes, we want that. Cannabidiol in humans, the quest for therapeutic targets, another one. Selling cannabidiol products, a framing analysis of advertising. You can pick that, but I don't think it has data on whether or not cannabidiol can be used to treat anxiety. Age-related difference in cannabis use, maybe we want to look at that. And so you pick all the papers that you think you may want to look at. Impact of cannabidiol on reconsolidation, disruption of naturalistic aversive memory. Okay, has something to do with memory. It's a clinical trial. In vitro and in vivo pharmacological activity of minor cannabinoids. Yes. So data, that's what we are looking for. Cannabidiol, that's a review. We don't want that. Cannabis in Parkinson's, the patient's view. we can probably take that. It might have something to do with anxiety. Cannabinoid use among liver transplant recipients. Yes, we can use that. Cannabis and emerging treatment for common symptoms in older adults. Yes, we can use that. Cannabidiol knowledge, perceptions, and use among adults in 6 US. Yeah, maybe there's nothing, maybe there is. Okay, we take it. Review, we don't want to use. So for this particular one, this is a clinical trial. Cannabidiol, yes. Delta-9 tetrahydrocannabinol, yes. Pantothenate kinase neurodegeneration, that's more data. Cannabinoids in clinical practice, it's a review. No, we don't want that. Cannabis for persistent pain, maybe we want that. There's depression and anxiety. So what we're looking for are fresh articles. So we take now no reviews, cannabidiol, no reviews, use of reported among primary care patients in Vermont. Brain imaging studies review, no. Chronic cannabidiol treatment did not exhibit beneficial effects in 4-month-old transgenic mice. Cannabidiol exposure increases anxiety. Serum cannabinoid 24 hours. So anything with data we take. Cannabidiol review, no. Chronic treatment with cannabidiolic acid, yes. Cannabis, are there any benefits? We go in and look. Acute cannabigerol, we look. Cannabidiol, we look. Cannabidiol, yes. Okay. Cannabidiol. If it has cannabidiol and anxiety, this is what I'm looking at. I'll decide whether there is merit later. Role of 5-HT1, cannabidiol, social media surveillance. No, that's not what I want. Interactions with cannabidiol, yes. Interactions, yes. So a hemp oil CBD primer, powerful pain, okay. Treatment of Fragile X, cannabinoid, no, this is a review, I'm sorry. Not required, review not required. Cannabidiol, yes, self-blinding citizen. Therapies, yes. So we are picking anything that has cannabidiol and then cannabidiol and anxiety and is not a review. So will they be many? Probably yes, but we'll still subtract some of them later on. So medical cannabinoids for treatment of psychiatric symptoms, yes. Systematic review, no. Endocannabinoid system as a therapeutic target for PTSD. Nice read, but not necessary for this. So as you can see, there are many papers to go through, and we'll stop at this point so that I can show you the next step. Once you've identified these papers, you come back up to the top and click on the display options button. The display options button has, the first thing is what kind of format would you like to see the display in? So in this case, I always choose abstract, and that's because it gives me more data than it gives me more data to look at. And then I also want to look at all of 200 abstracts. So, oh, I lost my results. So this, oh yeah, these are the results I had selected. So there are a total of 41 results. And what I'd like to do now is just scroll through to make sure that I do have some kind of data in there and that these are not any kind of review papers. And once I've gone through all the way to the end and determined that this is what I want to look at, I will then email these results to myself, which is at hkamendi@gmail.com or no, candy.com. And these results are now, you will email them to me and to yourself. Of course, you'll tell the computer you're not a robot. And sometimes you get all of this. So click on the ones that are not verify, and then it will allow you to email yourself. Once this email comes to me, I will go through them and I will be able to, we can talk about the ones that I don't think are relevant or the ones that you think are relevant, and then you can get started on mining the data. Once you have the papers, now I talked about a DOI. The DOI is this address right here. And technically, for all the papers that we identify, you will come back in and copy this DOI. And why would you copy it? Because remember, we said that after you have identified the papers, you will input them into Sci-Hub so that you can pull up the paper. Now, Sci-Hub is a website. Somebody has put up a website and uploaded all papers. And so when you come in here, you can either enter the URL, the PMID, or the DOI. I like the DOI, it's very specific. And I tell the tool to open. And what it does is it pulls up the paper for me if it exists in their database. And all of a sudden, I do have my paper. And what do I want you to do when you get in here? You can read all of this if you wish, but really the place I want you to focus on are the materials and method section. And the results section. And that's where you're mining data from. So over here, we may have to go back and forth until you understand exactly what it is that you're trying to do. I'm sure it won't be easy the first time round, but see how much you can get done. So that is you extract that data and you input it into this CBD worksheet. And this is an example to show you exactly what it is that you'll be looking for. Wishing you all the best. I hope we can collaborate on this and we can both get some value out of it. So let me know if you have questions and we can go ahead and go from there.